Concussion care is evolving, and best practices are leading to rehabilitation rather than rest and wait. While physical and cognitive rest is important for the first 48 hours, it is safe to gradually return to light activity to attain the best recovery. Unfortunately, today, individuals are still getting told to go into a dark place waiting for a passive recovery, rather than being proactive in their recovery. If you or a loved one suffers from post-concussion syndrome, also known as persistent concussive syndrome, you must be an advocate for your own recovery. Symptoms after concussion can involve dizziness, headaches, light and noise sensitivity, blurry vision, fatigue, anxiety, loss of concentration and memory, depression, impaired balance, irritability, and insomnia. There are a multitude of reasons for these symptoms, including cervical dysfunction, metabolic imbalance, vestibular dysfunction, or psychologic reasons due to anxiety or depression. This is why post-concussive care is an interdisciplinary approach, meaning that a team of healthcare professionals work together for your overall care. These individuals can involve a medical doctor, a physical therapist, an occupational therapist, a speech therapist, a chiropractor, a psychologist, psychiatrist, or clinical therapist. If you are not getting better and still suffer from the above symptoms, you will likely need a multidisciplinary approach. If you specifically need more vestibular rehabilitation for ongoing recovery, check out VIZSTIM.com for our concussion-based visual and vestibular exercise kit. It comes with a journal to easily track positive changes in your daily regime for optimal well-being. These key steps can unlock your recovery.